Pennsylvania is getting nearly $200 million to help with rural health care. That might sound like good news, but does it actually amount to a big deal overall cut? Seth Kaplan is live in the studio today with our top story. Hey there, Seth.
Hey, Mallory. Yeah, this dates back to President Trump's One Big Beautiful Bill signed last summer, which reduced future Medicaid spending by hundreds of billions of dollars, but offset some of that with what's called the Rural Health Transformation Program.
It's intensely of interest to rural areas where there is, just a lot of concern about how these cuts to coverage and financing are going to hit their healthcare infrastructure.
Kathy Hempstead of the nonprofit Robert Wood Johnson Foundation talking about the Rural Health Transformation Program. After months of waiting, state-by-state awards came out Monday. Out of $10 billion awarded this year, Pennsylvania got $193 million. Pennsylvania has nearly 4% of America's population, but got less than 2% of the funds. Half the money was already guaranteed to be shared evenly among all 50 states, regardless of their population. Another way of looking at it, Pennsylvania got about $15 per Pennsylvanian. Alaska got almost $368 per Alaskan. California, just $6 per Californian.
Most of the differences are explained by how rural a place is.
Dr. Mehmet Oz, head of the Centers for Medicare and Medicaid Services, which oversaw the process. Why might Alaska get so much more than other states?
They're going to start using drones to deliver medications because there are many parts of Alaska you can't drive to this time of year. So every state's different.
Generally, red states got more per capita than blue states, although there were exceptions. Reliably red Florida and Texas got less than $9 per resident each. Blue Vermont got more than $300. Kathy Hempstead says, relatively speaking, compared to a lot of states, parts of Pennsylvania actually have surprisingly good rural health care.
But it's like world class, and a lot of rural states don't have a Geisinger, which, doesn't mean Pennsylvania doesn't have problems, but it's a kind of a unique thing.
Oz said the program encourages states to streamline care by letting doctors practice across state lines and letting people like nurse practitioners practice more independently.
Is the state willing to do what is probably agreed on by most experts to be the right thing, despite political headwinds?
I think there's some exciting aspects to that, but it's in no way is it like an offset to what's happened with the One Big Beautiful Bill Act.
What has happened when you total all the subtractions and additions on a net basis, opponents say, is millions of Americans losing access, Dennis, to affordable health care. And that interview with Dr. Oz is something you're very well familiar with, Dennis.
Indeed. Seth, thanks so much.
Hi, I'm Eric Finkenbinder from ABC 27. We're excited to announce the new ABC 27 News Plus app. Live stream newscasts or watch content on demand. This is different than the ABC 27 app on your smartphone. You can check this out at home, and it's very easy to use. With a Fire Stick, go to the homepage, scroll down to search. From there, enter ABC 27. Move over to the apps, and there we are. Click the icon and install. It's just that easy.